So here we have our physical therapist checking the patient's lungs for sounds and signs associated with consolidation. He's using auscultation with a stethoscope. After completing that, he's going to roll the patient onto her back, and because she has a sacral ulcer, we want to alleviate pressure and maintain skin integrity. Here, our physical therapist is explaining to Miss Purdy how sensory testing will go through the examination, and he'll be explaining that he'll be touching her in various locations on her upper extremities and her lower extremities, and she'll have to let him know whether or not she can feel the sensation of the touch and where the sensation is felt, specifically on the arm or the leg. And you can see our physical therapist here, Mackenzie, is going through the sensory testing. Deep sensation can be tested through the use of kinesthesia. Here, our physical therapist explains how the test will be done, moving the joints in various positions, while Miss Purdy will then describe if the position is moving up or down, away or towards her body, depending on the nomenclature that the physical therapist uses for the test. We see that Mackenzie explained the test and then went to her unaffected side, as she had a right cerebrovascular accident a few years ago. So that left side is what we would expect to be slightly diminished in some of the senses. So he started with her right side, which should hopefully have no deficits that we would really know of, as we would expect some deficits to show up on that left side. But again, he starts on that right side and moves back towards the left. While upper extremity sensation has already been tested, now our physical therapist must also assess lower extremity sensation using light touch. Something of importance for patients that may have sensory issues with their feet, patients that might have diabetes, who may have some type of vascular disease that might affect the nerves in the lower extremities, especially from the knees down. This is something that's dangerous. It can lead to increased falls, and something you want to assess is the sensation of the feet of these type of patients. Here we see Mackenzie using the Jamar monofilament test to check for sensation of the feet, and we'll note throughout the test where Miss Purdy is feeling the sensation and where she is not, according to the landmarks provided on the Jamar test. A good way to assess a patient's function and check to see how their neurological system is integrating with their muscular system is to perform coordination testing. This testing is used to look for things such as dysmetria, and it is performed on the upper extremity as well as the lower extremity. So first, Mackenzie will have Miss Purdy perform the finger to nose. She'll bring her arm out to the side and then bring her finger towards her nose in an attempt to touch the tip of her nose. Noting any deviations, the physical therapist can then make predictions based off of how she performed. The lower extremity testing is performed by placing the leg on your foot on the opposite leg, right at the base of the shin where the ankle is, and sliding that heel up towards the knee and back down. Again, the physical therapist is looking for any deviations in a smooth transition up the leg and down the leg. The key role of a physical therapist is to restore and improve function for our patients. Here we see Mackenzie is assessing the function of Miss Purdy by seeing if Miss Purdy can roll over onto her side and get into a seating position at the edge of a bed. He provides as minimal assistance as is needed by Miss Purdy, and he lets the patient tell him through her actions and movements and also her words how much help she needs. While assessing Miss Purdy's ability to roll and sit at the edge of the bed, Mackenzie is also going to assess Miss Purdy's ability to stand from the edge of the bed and transfer into the wheelchair, which is positioned next to the bed. Again, he provides the minimal assistance that is needed, which is again dictated by how Miss Purdy responds to the transfer. After Miss Purdy is transferred, Mackenzie will continue with more functional testing and functional outcome measures. Balance is a great predictor of whether or not a patient will experience more or less falls in their everyday life. The Modified Clinical Test of Sensory Interaction and Balance, or the CTSIB, is a great test to assess a patient's balance. Here we're using the modified version. The full test is done by 3 trials of each setting, and the therapist notes if the patient is able to do it, how long the patient is able to do it for a max of 30 seconds, and whether or not the patient is displaying any type of sway, and will then assess the patient's score based on that. When working with patients with neurological complications, the physical therapist should always assess alertness and orientation of the patient. Another thing to examine is the cognition of the patient. This can be done through the mini mental state examination or the Folstein test. It's a questionnaire that is used in not only medicine but also allied health, and it is a questionnaire that helps screen for dementia, Alzheimer's, and also illustrates any cognitive impairments that the patient may be dealing with at the time.